Jean. My name is Grace Alvarez and I will be your nurse for today, and I will be performing how to properly put on and take off your PPE equipment. So first, what is PPE? PPE is used by us medical professionals in order to protect us from the health and safety risk at our work. This usually involves gloves, goggles, mask, and PPE gown. And this also helps us minimize the exposure to the hazard in our workplace. Now that we are done with the assessing, we're going to proceed to the planning. So in accordance to planning, putting on and taking off of our PPE usually takes time. So we already need to prepare our equipment beforehand. And the rationale for that is so that we can save time in doing the procedure. So right now, I already have here the gloves. This is used in order for our hands to not get contaminated. We also have here the face mask. This suppresses the transmission, especially from the breath that comes out from your nose and your mouth. We also have here the goggles. This protects the surrounding of our eyes. And we have the PPE gown. Serves as a barrier between the patient and the medical user, or the medical professional rather. Now that we're done with the planning, we're going to go ahead and proceed to the implementation. So before proceeding into the implementation, or the procedure rather, we have to make sure that we are not wearing any jewelries, such as rings, bracelets, or watches. And if we are wearing them, you have to remove them right away. And prior also to proceeding into this procedure, Jean, in order for our healthcare to secure us, we need to follow this protocol properly, and we need to wear our PPE properly as well in order for us to lessen the transmission of infectious disease or viral diseases or nosocomial diseases onto the patient that we are going to perform our interventions. Now that we are done with that, Jean, before I go ahead and proceed to the procedure, first I need to perform hand hygiene, alcohol-based hand rub. And the purpose for that is so that my hands are not contaminated once I touch the equipment. Hand hygiene also, Jean, is actually a preventive measure for us to protect you, patients, and our professional healthcare as well, so that they don't get nosocomial diseases. Now that we're done with that, we're going to get our PPE gown, and we're gonna unfold it in front of us, making sure that it doesn't touch the ground surface. And the rationale for that is that the ground can contaminate your PPE gown, and you do not want that. Now the next thing that you need to do is to put your arms and hands through the sleeves. Now the next thing that you're gonna do is to secure the neckties. And the rationale for that is so your gown can stay in place. Now that you're done with that, you're going to tie the tie in your waist. Overlapping of the gown might be very useful as well to make sure that you cover as much part of your back of the uniform. And the rationale for that is you want your back uniform to be protected as well, and tying it properly can help it to stay secured and so that it will not fall into the ground as you are doing your interventions. Now the next thing that you are going to do is to put on your mask. You have to get the mask from the backs. Make sure that you do not touch the backs of the mask. Now you're gonna grab it from the top of the mask. Now that you have it here already, you're gonna grab it from the ear loop and attach it into your ears. Now what you're gonna do is to put the metal strip of the mask on top of the bridge of your nose. Now the rationale for that is you want it to be under the goggles to prevent clouding of the goggles. You also have to make sure that you secure the bottom of the mask as well, Jean, because you want it to be secured covering your mouth in order to, since considering that the breath comes out from your nose and your mouth, and that can also contaminate your patient, or you could also be contaminated by that. So the next thing that you do, now that you're done with your mask, you can go ahead and put on your goggles. There is no specific way of putting on the goggles, really, just go ahead and put it on. Now the next thing that you need to do is to put on the gloves. Also, there is no special technique in putting on the gloves. But you have to remember that when you are putting on the gloves, if you're wearing a PPE gown, like I am right now, you need to, I'm sorry, I'm having a hard time. You need to overlap the glove on top of the cuff of your PPE. Rationale for that is you want to cover the skin. You do not want any skin to be exposed once you are already in the surgical area. Or if you're not wearing any gloves, any PPE gown, just make sure that you also cover a part of your wrist. Here we go, Jean. Make sure also, Jean, that you do not damage the glove or make holes in it. Now that you are done with that, we are done with donning of our PPE, Jean. We're putting on our PPE. Now we're going to remove our PPE gown. So first, you start off with the gloves. If your tie of your PPE gown is in front, you can remove it first. But since it is in the back, we are going to remove our gloves first. So remembering this, guys, since they are already contaminated, let's just pretend, Jean, that they are already contaminated. So we have to make sure here that we do not touch our bare skin with it, correct? So that we don't contaminate ourselves. So what we're gonna do is to grab the glove from the palmar surface of your hand and turn it upside down, or inverted rather. Now that you're done with that, you're going to go ahead and remove the other one as well. Now what you're gonna do here is you're gonna insert two of your fingers under the glove, making sure that you do not touch again the contaminated area of the glove. And the rationale for that is that you do not want to contaminate your hands, your bare fingers. Now that you're done with that, you're going to discard this. And now that you're done with that, you're going to remove your goggles. Also, if this is disposable, you can go ahead and throw it in the waste container. Or if they are not disposable or reusable rather, you can go ahead and put them in a designated area so that they can be cleaned for the next user. Now that we're done with that, before we remove our face mask, we need to remove our PPE gown. First, untie it from the back. Make sure that you do not touch the contaminated area of your PPE gown, or else rationale for that is if you do touch the soiled parts of your PPE gown, you can get contaminated. Now the next thing that you're gonna do is untie it from the neck and hold it from within, making sure again that you do not touch the soiled parts of that area. And now you have to make sure that you do not shake your PPE gown. Now that you're done with that, fold your PPE gown inside out. Do not touch the soiled parts of your PPE gown again. And once you're done with that, you can go ahead and put this in a designated area so they can be used for future purposes. If they are reusable or if they are disposable, you can go ahead and put it in the waste container. Now that you're done with that, before you leave the room, you have to remove your face mask. And you can remove your face mask once you are already at the door of the client. Now, let's just pretend that I'm already at the door of the client, Jean. So what you're gonna do with your face mask is remove it from the ear loop. You do not want to touch the surface area because they can contaminate you and you can get infections from them. Now that you're done with that, you're going to go ahead and disinfect this to the trash can near the door of the client. And that is basically all for today. We're already done with the donning and doffing of our PPE. Thank you so much for listening.
It's my life.